Good morning, everyone. I am Heno Kailu, and for today, I'll be talking about psychological and mental health aspects in COVID-19. Um, I'm a counseling psychologist and currently working at Addis Ababa University, Department of Psychiatry. I am the program head for the Clinical Psychology Master's Program, and I am also the current president for the Ethiopian Psychologists Association. And I am also advising the Ministry of Health and mental health and psychosocial aspects of COVID. So my presentation is going to be, as I have said earlier, it's going to be on psychological and mental health aspects in COVID-19. I will be focusing on three aspects. One will be, I'll be talking about the psychological and mental health aspects of COVID-19 on the general public. And the second would be, I'll be focusing on people who are in quarantine and isolation and in treatment centers. And thirdly, I'll be talking about the psychological and the mental health aspects of COVID-19 in frontline mental health professionals. I'll be using a PowerPoint that I'm sharing currently on your screen. I'll try to be as brief as I can. In order to start with the expected psychological reactions in COVID-19, the below listed psychological reactions are not only specific to COVID-19, but also applicable in every pandemic or endemic that has been affecting our world and our country. So, but currently, based on our personal observation on the field, on the ground, and through the document analysis that we have made, we have come up with this a summary of this below listed expected psychological reactions. So we expect people to have anxiety, fear, worry, and concern for their family as a result of the pandemic. So people might be anxious about many things regarding the pandemic. One would be like an anxiety and fear and worry about maybe they will be infected or they might be infecting family members and so on. But also people might be worried about what if things go wrong, what if things will become out of my control. This kind of fears might appear on individuals. And this might make people to take inappropriate measures. There are certain inappropriate measures that we have seen people taking all over the world and specifically in our country. Just to give some examples, clarification on this. For example, I don't know how many of you will remember back in 2 months when the first case was confirmed here in Ethiopia, many people were thinking many things are, which are like traditional remedies are cure for the COVID-19. So many people were buying areke, the local drink, was tripled or double price. Many other local remedies has been tried and used. So one of the things that I would like to say is I'm not against any of the cultural or the traditional remedies, but the thing is, this is like without any confirmation regarding their appropriateness, their effectiveness, people will be like taking inappropriate measures. And even the other inappropriate measures that people have been taking here in Ethiopia and in all over the world was hoarding. And I think hoarding is a psychiatric concept. Like people will be gathering many things that are useful for them or not, things that are necessary for them or not, in any situation. So people have been hoarding household materials, sanitizers, masks, gloves, and so on. So this is another psychological reaction. The other is uncertainty or frustration, and uncertainty and frustration are also the other type of expected psychological reactions. People might be uncertain regarding the existence of the problem, the prevalence of the problem, how much it is affecting, even regarding the information, the measures the government and the relevant bodies are taking. People will be uncertain and might have frustration. So again, another example for this would be back in 2 months again, people were saying that because the number of cases that we were reporting are very low in numbers, people were saying that the government is deliberately, or the Ministry of Health and or other bodies are deliberately hiding numbers. But now, like after 2 months, now we're like reporting 25, 29 cases a day, and people are saying this is deliberately done by the government so as to create a certain level of anxiety. People are attributing this to certain political issues and so on. So this is also something expected. And the other is frustration. People will frustrate as a result of many things. Uh, I will also try to add some pointers on my next slide regarding frustration, because frustration is not only an independent reaction, but also it will be a result of many other reactions, uh, or a combination of many reactions. Um, the other psychological reaction would be people might have anger, especially blaming others for others' negligence for their infections and so on. So another practical example for this would be is that I heard this as a joke initially, but it was like being said by many other people, and then it was creating some anger among people. So people were saying that the under quotation, I'm quoting this directly, the Chinese people ate whatever they ate, and then now it is our responsibility to wash. So it seems like a joke, but it was like being said by many people, and it was becoming a fact. So people were saying that it's like the responsibility of the Chinese, so it's the white people problem, and that's why we're having. So they were blaming others, and I know I think most of you will remember one of the incidents that we had back in Thumandis, that many white people, especially Asians, was like attacked, abused, and stoned by people here in Ethiopia. This is like typically an anger response of others blaming others' negligence. So people are saying that we're infected because of the negligence of others. This is also another expected psychological reaction. People might withdraw, will become numb. So numbness and withdrawal will have a different degree, but one of the withdrawal will be, people might say, this withdrawal and numbness might make people not to react in any way, to deny, which includes like to have the severe level of numbness. And another important thing is that we have seen, and literatures are also justifying, is that substance misuse is increasing, both in our country and all over the world, because people are expected to stay home. The recreational activities are being restricted. The usual activities are now changed. The routines are changing. So as a result of this, the rate of substance misuse is increasing. Another thing is depression, loneliness, and boredom is also something expected. So because of the stress, because of the anxiety, because of the fear, and because of the change in routines and many other aspects of the COVID-19, people might be depressed, feel lonely because of the social support will be like disrupted, or people are expected to disconnect from the social support as a result of the disorder. One of the unique nature of this pandemic is that it highly restricts people's social interaction. As we all know, we're talking about the social distancing, the lockdowns, and so on. This will result boredom and loneliness. The other is PTSD. So I just wanted to talk about this PTSD specifically for the general public, for the frontline health professionals, and also people who have gone through quarantine, isolation, and treatment. So just to share one very interesting experience that I have seen as a result of this COVID-19 here in Ethiopia. The people who are under treatment and who are under isolation will be taken by the ambulances, the ambulance cars, and after their remission and after the treatment and after they finish their time in isolation, they were asked to be transported by the ambulances, and all of them refused. This was a very interesting thing. So we just asked them why they refused to use the ambulance, and then what they were saying is that their experience regarding their initial transportation to the quarantines and isolations through the ambulances, the vehicles, were like very traumatic for them, because they were told to enter to the car. There are like policies together accompanying the cars. So what they were saying is like this is very traumatic, and it made them to be afraid of the ambulance and so on. So some people were also saying, some literatures reported that some people in Italy and in the United States were saying that they are now having a panic attack whenever they are hearing the siren of the ambulance. So this is like also possible thing, and even for the health professionals, it's going to be traumatic, because health professionals are expected to see people's pain, and like to see many horrible stories of people, to see people dying and so on. So this is going to be very traumatic for many people. One literature that I have seen coming from the United States was that they were like health professionals were made to uh, to allocate the mechanical ventilation for people who are mostly in need. Like this will make you to have um, a quarrel with your moral and to question your morality and so on. So this is going to be definitely traumatic, and that's what literatures have been saying. The other is resilience and versus recovery. Even though we have said that these are the expected psychological reactions in COVID-19, not necessarily that everybody will be having a same level of the above stated psychological reactions. Most of us will have resilience. What we mean by resilience is that our psychological elasticity. So whenever we're stressed, whenever we're having a problem, we have this ability to elasticize and then to overcome problems. That's what we call resilience. But there are times that that sometimes our resilience might be broken, but still most people will have resilience, and some people will also recover. This is what we have seen, especially in our country. The first 1 week and the first 2 weeks were very chaotic and regarding the general public, especially that's what we have seen. Even in the system, we were not well prepared. Like what I mean by well preparedness is that it was clear that the emergency operation centers were established and so on. But since we haven't got the many cases, um, we were not thinking about additional services like psychosocial support, mental health support, and so on. So the mental health support, the psychosocial support were like in place after like 15 days and after a month. So this kind of things are like recovery signs. So like we'll be panicking, we'll be anxious, we'll be worried about some things initially, but through time we'll recover. So these are expected psychological reactions. There are factors contributing for the psychological problems and factors. One of the things is that is lack of knowledge, which includes barriers to information. So another interesting fact about this COVID-19 is that mostly this pandemic is about information, and knowing that what we know about the virus, what has been studied about the virus is very little. Many new informations are coming now and then. Many new precautions are coming now and then. Again, there are many updates daily. So this will make barriers to information, especially for a third world country like us. Getting the appropriate information on time is somewhat difficult. And not only that, there is lack of knowledge and barriers to information, but also the informations that we will get sometimes might not be relevant to our context. It's obviously clear we're talking about the same pandemic that has happened in Asia, in Europe, and in the Americans. But also, when it comes to our cultural situation, many of the things might be different, including the virus manifestation, including the psychological problems, including people's reaction, the economical impact, and so on, will make it very different. So it's very important to get tailor-made information, which is right and appropriate and applicable for our situation. But not having that information will increase the previously discussed psychological aspects. The other is that there will be an open loop for misinformations and rumors. So, as I've said earlier, what we know regarding the pandemic is very little, and there are updates every time. So it's like it's very open for misinformations and rumors. There are some rumors that have tried to state under this. One of the things that I would like to say about this misinformations and rumors is that the misinformation and rumors are not like fully. They're not like only just fake information, but they might have some fact. But what makes them different is that they are not factful as a whole. For example, regarding traditional remedies can cure. So there was this information when the pandemic was manifesting over the world in the initial times of its manifestation. It's because it's like people were saying that because it's a flu-like, traditional remedies that we have been using so as to cure any other type of flu would cure. But remember, so this information will be misinterpreted and people will understand in a way that will match what their desire. So people would say definitely that traditional remedies can cure. So there is a fact regarding that, but it's not fully justified. It's not tested and so on. And even the second one, only the old are affected. So this is also based on a fact, but it's not the way it was stated is not right. So again, as we all know, during the initial stage of the pandemic, it was said that uh, the virus will be affecting mostly people who are old and who have comorbid problems. So this was the fact. But that doesn't mean that only the old are affected or it's not going to affect the youngs and so on. So this is very open. This will make it very open for misinterpretations, for misinformations and rumors. And the other is that it's a bioweapon. And again, this is what we call a conspiracy. I just wanted to add the psychological explanation about conspiracies here. Um, so, in logical argument, there is what we call a premises and a conclusion. So, in order to reach into a certain conclusion, we need to come up with a justifying evidence, which is a premises. So, after I came up with a plausible and factful premises that will make me to come up to reach to a conclusion so that I'll make a logical argument. But regarding the problem with conspiracies is that there is a fact, there is a conclusion, and then we'll be looking for premises that will justify the fact which already exists. So it's a fact that COVID-19 exists. It's a fact that it was initially found in a Wuhan state in China. This is a fact. Now, if I look for premises that will fit into this, I might say like the Americans and the Chinese were having a trade war one another, and this is a bioweapon and so on. So it might sound like this is right, but I can't justify it because the reason why I can justify it is because I am trying to justify an already existing conclusion by trying premises factors that will fit into the conclusion. That's the problem of um, conspiracies, and this is going to create a high level of psychological problems. So these are the factors contributing to psychological problems, and the other factors contributing to the psychological problems is like being quarantined and isolated, and being like passing time, having a time in quarantine and isolation is also a source of psychological stress because one is the duration of quarantine. So initially the duration of quarantine was 14 days, but because of many other technical and many infrastructure and other issues, the duration of quarantine was doubled or tripled in many of the places. This will create an anxiety. So people will say, I was told that I will be staying here for 14 days, but now I'm staying 20 days. Maybe I might be infected. Maybe my sample, there is a problem with my sample, and so on. This will create a certain kind of anxiety, worry among people. And regarding duration of quarantine for health professionals who are staying in quarantine, who are staying in isolation, so as to take care of the people in quarantine, will also develop a fear of infection during the quarantine. They would say like, I might be infected while treating people here in the quarantine in isolation. And even those who have been quarantined will say like, I know that I'm definitely sure that I am negative, but I might be infected while I'm staying in the quarantine. This will create a certain type of psychological problem. And the other factor, which is related to quarantine and isolation and treatment centers, is that when people are quarantined and isolated, and when they are like expected to be in a treatment center, there is going to be a change in their daily routines, which is going to affect people's psychological coping mechanisms. So they will not be having their daily social support. They will not be connected to their parents, loved ones. They will not be doing what they want, what will make them calm and so on. These all factors will affect their psychological well-being and also will create a psychological. Imagine yourself sitting in a room for 14 days, uh, being not able to go out of that room, and or like only a restricted time of going out of your room and then spending time there. Most of our quarantines are high schools, universities, university dormitories, and so on, which are not equipped with internet, no phone connection, and so on. All these things will aggravate people's psychological problems. So this is another factor. And the other is stigma and discrimination towards the infected people, towards people in quarantine, and towards people in isolation. So people will